So thank you so much for having me. I'm very excited to be here. As has already been mentioned several times, my name's Hilder, and I'm the author of a book called Things Not to Say to Someone Who Has Cancer. Now you might be assuming that because I wrote a book called Things Not to Say to Someone Who Has Cancer, that's what I'm going to speak to you about, and it is. But I am really well aware that I'm actually speaking to a room full of people who have either had cancer, have cancer now, are living with a cancer diagnosis, or who work professionally in cancer supportive care. So this kind of means I'm talking to a sympathetic audience, I hope. I started writing about the things not to say to someone who has cancer as a result of my own cancer experience, which has already been mentioned. And I would like to say that I didn't have breast cancer. I will tell you that straight up. I actually had non-Hodgkin's lymphoma, and that was 10 years ago, but I'll talk a little bit more about my own cancer experience in a couple of moments. So before, yay, it works. Oh, there it is. That's my book. It's a beauty, isn't it? Very proud of it. Very proud of that little baby. It took me a long time to give birth to that little baby. So I'm going to be referring to survivors quite a lot in this talk, and it's a term that we've heard quite a bit already today, but I'd just like to unpack it a little bit because some people really don't like the term survivor. Some do, but as often as I'll get people come and speak to me and say, yep, I'm a cancer survivor, I'll get a couple who'll come up and go, I really hate it when they talk about cancer survivors. I don't call myself a survivor for whatever reason. I will be referring to people who are living with a cancer diagnosis or after cancer as survivors today. If you would like to come and talk to me about that later, I would love to talk to you about it. I can also show you my thumping great big survivor tattoo if you'd like to have a look at that, and you might like to show me yours. And I'd like that too. So survivorship, why is survivorship so important? It's an area that more and more organisations working in cancer are beginning to actually look at. Survivorship is a very, very important field, mainly because we've not been doing very much about survivors. We've been looking after people who've been diagnosed. We've been looking after people after they've been diagnosed and in their treatment phase. And then when they finish their treatment, they send them out the door and they say, bye, have a nice life. And we go, I beg your pardon? How do we do that? Because we all know that when you finish treatment or when you're on a maintenance, it doesn't necessarily mean that your cancer experience, your cancer journey is over. You then enter what is clinically known as survivorship. And this is becoming something that organisations need to really deal with because we've got lots more survivors than we're used to. We're curing a lot more cancers and people are living longer with a cancer diagnosis, even if they have a prognosis. They're actually living longer. And so survivors are a group that we're actually having to deal with, and we are them. Here we all are. I'm 10 years out, so I consider myself a survivor, but I've got friends who are living with a cancer diagnosis long term, and they're also survivors. And people who are currently having treatment are survivors. Some of the issues that we're seeing in survivorship are around cancers that we actually dealt with 10 or 20 years ago. So people who perhaps had childhood cancer that are now grown up, that are finding they've got issues around fertility, perhaps, or issues around some of the social issues that happened in their family when they were a child and had cancer. And these are issues that organisations like the Cancer Council and others are looking at and kind of going, what are we doing about this? We kind of figured that cancer was finished when someone came to the end of their cancer journey, but it's just not so. Yeah, so we know that it's actually imperative that people during their cancer experience and after their cancer experience receive adequate psychosocial supportive care because it actually helps us do better and live longer. And the quality of life that we have is actually improved, and they've shown that people that receive adequate support when they're going through treatment actually do better in terms of recurrence rates and in terms of their psychosocial outcomes, which is a fancy word for saying what we think and feel. So a little bit about my story. So just a couple of days ago, I actually had my 10-year cancerversary, which was, thank you, which was the date that for me, that's the date that I was diagnosed, which was the 17th of July in 2003. And these pictures are just a little snapshot of my cancer journey. I almost didn't get diagnosed with cancer, which would have been very bad. Thankfully, they did get it in time, but it wasn't for lack of trying on my part. I'd become quite unwell at the beginning of 2003, just with what felt like the flu and some general feelings of unwellness, some night sweats, some weight loss. Hello, something's wrong right there. I don't lose weight. And, you know yourself when you're just kind of going, yeah, something's really not right here. Didn't have any lumps or bumps, actually went for a mammogram, which was clear. What is going on? I went back to my doctor 2 or 3 times and received the same response every time, which was, you're just working too hard, sweetheart. You need to just take it easy. Okay, tried that, didn't work, got sicker, lost more weight, got some very interesting lumps and bumps in my neck and throat, which he refused to feel, got a bellyache, which he refused to put his hands on my belly. Can I have a blood test? No, I don't think that's necessary, do you? Just didn't want to know about it, which culminated in the July when I was teaching patchwork at my shop and started to feel very, very unwell. Rang my husband up and said, I think I need to go to the hospital. It's really that bad. I felt like someone was strangling me, throttling me. I felt like I had a dry sock shoved down my throat. I couldn't swallow. Within half an hour of being at the hospital, they found a tumour the size of a saucer inside my chest. So at Maxville Hospital, which is a teeny weeny little hospital, they panicked and said, we don't know what to do with you, threw me in an ambulance, sent me to Coffs. We were living on the North Coast, obviously, at that time. Coffs Harbour looked at me and said, we're pretty sure that that's a lymphoma, but it's flying too scary for us, so you need to go away from here. So they put me in a plane and sent me to Royal North Shore, where I stayed for a couple of weeks. And that was where I began my 3 months of chemotherapy and two months of radiotherapy. So the picture on the, on the far right there, my right, is in between my first and second chemo when I'd just gotten home to Nambucca. And we were sitting on the lounge with the kids. We've got 4 kids, my husband and I. They were ranging in age from 15 down to 3 years old, and I went like this and my hair came out. And a lot of you will relate to that experience. It was gut dropping. So we decided to make a game of it. What else can you do? I've got other photos of all of my kids and myself with moustaches made out of my hair. And after that, we promptly went out in the garage and shaved my head. The one in the middle is me a couple of months later being photographed at Daffodil Day for Nambucca Guardian. And the one over here is me looking like a Buddhist nun on summer holidays, is actually me about halfway through my chemo. So with that face that, you know, when people come up to you and go, oh, you're looking so well, you know, well, I do. I look at that and I go, I did, I look great. I'd lost weight. You get that kind of red suntan face, you know, you look fantastic and you feel like crap. And everyone's telling you look so good. Things not to say to someone who has cancer. 1, you look great. Yeah. So there you go. So there was a few things that started when I was diagnosed with cancer. One of them was my treatment, and there was the 3 months of chemo and the 2 of radiotherapy, which I was obliged to have down in Sydney because they didn't have radiotherapy in Coffs at that time, so I went down to Sydney and stayed for 2 months down there on my own. And the other thing that started were the cliches. So were the things that people like to say to you when they find out that you have cancer, of which I've listed a few here for you. What doesn't kill you makes you stronger, darling. Yeah, right, strong enough to punch you right in the nose. Everything happens for a reason. We've all heard that one. I think God is trying to teach you something. And my special favourite, my neighbour had that and she died. Because that's going to make you feel so much better. And I've put the one in the middle because that's the one that we hear all the time. Okay, now some of you are going to love that one. Some of you, like me, are going to absolutely despise that one in the centre. But I will go onto that a little bit later. So when did we start talking about this certain language that we've got around cancer? Because we've all heard it. It's not just the cliches, it's this war on cancer thing. And all of us find ourselves embedded within this war on cancer thing, whether we like it or not. We come into a cancer experience and all of a sudden people start using a certain kind of language around us with words like fight and battle and war and victims and heroes and all of that kind of stuff. And you're like, and brave and courage and all of these things which are the opposite of what you're actually feeling. I used to get really confused when people would ask me about my fighting cancer, because all I used to do was go in on a Thursday afternoon for 4 or 5 hours and sit in a great big green puffy recliner chair and look at all the other people knitting and chatting and watching TV and think, when do we get to start to do the fighting? For me, there was just, I found it really hard to relate to what people actually thought I was doing while I was in my cancer experience. I used to take a bath at 9 o'clock in the morning every morning. Yay, look at me, I'm battling cancer in the bath while you're all at work. And my favourite thing to do was to ring them up while I was in the bath. Guess where I am? The bath. So there's fighting cancer and fighting cancer, isn't there? But when we talk about the war on cancer and this language, there's actually a point in history that we can actually nail it down when we started talking like this. And it was in 1971, believe it or not, in the USA, when Richard Nixon signed the National Cancer Act for US legislation. And they began to talk about what they were going to do to beat the leading cause of death in the USA at that time, which was cancer, as being the war on cancer. And it really captured people's imaginations, and you can understand why. When you think about the imagery that it inspires of, this insidious force coming against you and, invading your borders uninvited and just wreaking horrific damage wherever it goes, and then leaving you possibly dead, if not maimed. You can understand why people were really captured by this type of language that they started using. The problem was, the context changed, but the language didn't. So at the time when we started talking about the war on cancer, there were a few factors in play. The factors were that back then, they hardly ever caught cancer as much as what they do now. So screening and diagnosis methods were less superior than they are now. So they weren't catching as much cancer, and by the time they caught it, often it was too late. So people were dying far more, earlier, and they were dying more frequently. And the treatments that were around back in the 70s and earlier were quite primitive. So they were doing very, very invasive surgeries, and they were still tweaking their chemotherapies. They had no idea what they were doing with radiotherapy, so they were really just playing around with everything that we've got down to a fine art right now. So the cancer experience was way different back then. It was far less under control than what it is now. And so when they started talking about the war on cancer and the cancer battle, it fitted. And you think about the political climate back then of places like the USA and the kind of culture that was around, think Vietnam and all that kind of stuff. It was a very militarised culture. And so this idea of the battle really fit. But what it's done is it's actually created a really fixed cancer language. So despite the fact, as I said, that we've got advances now in what we can do about cancer and how often we're picking it up, we're still talking about the battle and we're still talking about the fight. And that's kind of okay, but it's kind of not. The reason why it's okay is because it's all right to define your own cancer journey. So if you want to call it a fight and a battle, that's fantastic if it empowers you. But often what it will actually do, and what it has done, is this battle imagery has created a mindset in the general community of what cancer is about. And it's also created a mindset of what we can do about it. Now, if you think about that, we're talking about the changes that have happened between the 70s and now being so advanced that most cancers can be dealt with, if not cured. But we're still talking about it in terms of the way we were talking about it back in the 70s when we couldn't really do that much about it. And so most people have in their mind that cancer is a battle. It's a war. That you get invaded, and once you've got it, you're probably going to die. That's what people generally think. And probably a lot of us, that's what we thought when we were diagnosed with cancer, is that fear, that terrible, terrible fear that sets in. And that's what I mean when I say the culture of fear and powerlessness that surrounds cancer. When you think about other physical ailments that people can be diagnosed with every single day, that have similar mortality rates, that have similar amount of interventions concerning treatments, say heart disease or diabetes, if you tell somebody that you've just been diagnosed with diabetes, what's the response? If you tell somebody that your doctor says you have to take medication for the rest of your life for heart disease, it's a very different response than if you tell them that you've got to go and have 6 months of chemo. So when we talk about the cliches, let's just go back there for a couple of minutes. We talk about those cliches that we've all heard, like, oh, what doesn't kill you makes you stronger, or, just stay positive. What are they really, and why do we use them? Well, it's the fact that cliches, when we talk in terms of language tools, cliches are actually a language containment method. They're a way of dealing with the uncontrollable and the scary. And this is why they pop out when we tell people that cancer's in the room and they want to leave the room. Often what they leave in the room with us is a cliche. So they just want to manage it somehow. They want to reduce cancer down so it seems smaller. And it's almost a reflex. The cliche pops out. So it helps to bring that uncontrollable back under control. And a cliche is an answer to the unanswerable question. I have breast cancer. Oh, well, the universe is trying to show you something. You know, like we're grabbing for answers, we're grabbing for reason, we're trying to actually attach some sort of meaning to it, so we use the cliches. But why don't they help? Because they're not true. When we talk about most of the cancer cliches that we use, they're actually way off base. Here's some of the facts behind the cancer cliches and the fear. Is that most people have a perception still, unless it's happened to them, so this probably won't apply to you because it's affected you somehow, but most people who haven't had a direct cancer experience report that they still believe that cancer is rare and unlucky, which we know isn't true. They also say that they still believe that cancer is a death sentence, which we also know is not true. They also believe the cancer stereotype, so they believe what they've seen on home in a way that your hair always falls out and you always look pale with dark circle under your eyes and you always walk around like this. You know, they believe all of those stereotypes about cancer because of what they've seen on TV and in the media. And they are still afraid of cancer and its consequences. But the fact is, and we know, that there could be people walking around in your world right now who have cancer and you would not even know it. And so those stereotypes simply don't apply. So this goes without saying. The cliches don't help because they're glib and meaningless. They're a conversation stopper and they're a closed answer rather than an open question. Here's some of the other cliches that come out when we talk about the battle language. We talk about heroes, we talk about victims, we talk about winners, losers, battles and fighting and positive thinking. What's wrong with that? Well, because when you're being told that you're a hero, often people report they feel a lot of pressure to be brave. They feel a lot of pressure to behave in a certain way. And the last thing you want when you feel sick is someone telling you how you have to behave. I particularly used to find that really, really difficult when people would say, oh, you're being so brave. Being so brave. And you'd think, what choice have I got? What, shall I just fall apart in front of my 4 kids? Shall I? Like, that's going to work. So it's not like we have a choice to do this. And people report that they feel a huge responsibility to be stoic and to be firm and strong around people because of this connotation that cancer patients are always brave. We also start talking about victims and winners and losers. And I probably don't need to tell anybody in the room how difficult that can be to deal with. I never ever wanted to be called a cancer victim. I personally don't subscribe to that label at all. A lot of people are nodding their heads. It's not good language. It makes you feel disempowered. It can actually disempower you. And when people change the way that they see you, it changes the way that they treat you. And again, with the losers and the fighting and the battling and the positive thinking, I mean, every time a celebrity passes away from cancer, the paper or the news person says they lost their brave battle with cancer. And I always wonder, well, who won? Who won? When the person died, the cancer died too. So how did cancer win? Number one. And also, it tends to erase every wonderful thing they've ever done in their life before when we say they lost their battle with cancer. What about everything that happened before that? What about everything that they were before that? Cancer can never define a person. It's never greater or more creative or wonderful than they ever were. And I think it dishonours them to use that kind of language around it. So I make it my mission to actually pull people up on that when they say that. And then there's the old positive thinking, which I just want to briefly visit, because a lot of people have even said to me today up on my table about the positive thinking thing. People often will think they're doing a really good thing by saying to, oh, but you just need to think positive. Now, I do a lot of speaking at New Age festivals as well, and this is, you know, very frequently tied in with the idea of affirmations and, saying positive things, which is great. It is really good. It's very important to keep, a clear mindset. But often what I do in coaching, because I'm a cancer coach, and one of the very first things that I do without fail with a client is they will come in and they will say, I am having trouble with my negative thoughts. And I'll say to them, so what are these negative thoughts that you're having trouble with? Well, I think about maybe I'm going to die, and I shouldn't be thinking about that. That's bad. That's negative. I shouldn't be doing that. Everyone's telling me I have to think positive, so I have to put that thought aside. Okay. And so we'll actually spend usually a full session or two bringing some of those negative thoughts into the room. Because you know what they are? They're an emotional and psychological response to a trauma, to a very, very heavy thing that's happened. It's an emotional response. And when we judge those thoughts and feelings as being bad, then none of those things are getting dealt with. They're actually not bad. They're just part of who we are. If you were in a car accident and you wanted to talk about what had happened, no one would judge you for wanting to talk about that. So when someone receives a cancer diagnosis, why do people jump on them and say, no, can't talk about that. You can only be positive. I could show you two bodies of research, one that says that positive thinking helps with cancer outcomes and one that says it makes no difference. So you can look up Mr. Google or whoever you want to find anything to substantiate your claims. All I would like to say is that from my experience, it does not help when we tell people that they can only have the happy thoughts. And often it can be quite damaging because what doesn't happen is those conversations that need to happen don't occur. So when we're talking about death and dying, which our culture does not do very well and nobody wants to talk about, and yet we actually need to talk about it if it's on the table. We did with our kids. We took our kids aside and we said, look, it's a very real possibility mummy won't survive this. But we want to be the ones to tell you that because I didn't want anyone else telling them that. And they handled it quite well. It was hard, there were tears, but it was in the room. And I would not judge them as being negative for bringing it up. So why would I do that to myself? If I wouldn't judge a child, for bringing up death and dying and being sad about it, why would I judge myself? Just putting it out there. So having brought all of that out and said, these are the things not to say. Cliches don't work. Closed questions don't work. Just expecting people to say and think positive is not really very helpful. What do we do instead? Well, how about nothing? What do we say instead? How about nothing? I have people report to me more and more, and particularly when I was researching the book, that one of the things they found the most helpful and the people that they grew the closest to were the ones that would come into the room and actually say nothing at all. They would just be prepared to sit there and have a cup of coffee, or would just sit quietly in a corner and read a book while they were having chemo, or would just come and be with them. Sometimes nothing is the most perfect thing to say. Also, when I was writing the book, I really opened and unpacked this subject of open questions. So often when people come to you and you've had a cancer diagnosis, they'll say these really closed statements like, does it hurt? Are you going to have an operation? Which boob are they taking off? And the minute someone brings those kind of closed questions into the room, it's like, well, what else am I supposed to talk about? We can't talk about anything else. When I speak to groups of people who haven't been diagnosed or even health professionals, I talk to them about open questions and I say, when you come into the room, say something like, so how are things going at the moment? So easy. It's an open question. Once you've brought a sentence like that along, you can actually take the conversation anywhere you like. Just pick the kids up from school, one of them's got head lice. I went to Aldi yesterday and picked up a da-da-da-da-da. You can actually talk about anything, or you can talk about cancer. So I actually teach people to put that one in their toolkit. So how are things going at the moment? So easy. I could have just written, a 100-page book and just written that in the middle and said, just go to the middle of the book. That's all you need to know as a person who knows someone who has cancer. Now, why the big deal about the cliches and the positive thinking stuff and all that? Why is it such a big deal? Because the minute that stuff comes out, what happens is there's a disconnect. So someone says a cliche to you, it doesn't make you want to grab them and hug them and say, I'm so glad you understand. No, it makes you want to slap them, There's a disconnect that occurs. You withdraw from them. and they feel like they've answered the question and gone, there you go, I've just solved your big cancer dilemma with the big God has got everything in control thing, so I'll be going, okay? Disconnect. So the reason why it's so important to discuss the conversations that we have around cancer is because everybody that I talk to who's been diagnosed with cancer says that what they really, really want more than anything is support and information. And often that's a code word for, I want someone to stay in the room with me. I want someone here that I can talk to. I want someone who will listen to me. I want someone that I can actually just sit with, who will be present. And whenever we bring all of that language into the room, that can't occur. And so a lot of what I do is talking to groups like this of people who haven't been diagnosed with cancer and saying to them, this is how we do it. This is how we talk. Ditch the battle language. Don't talk about the fight. Just say to them, so how are things going at the moment? And also training them to stay in the room with cancer, because let's face it, it's hard and it's scary. Sometimes we scare people and we just don't mean to. Sometimes a bald head can just scare people, you know? And so there's an onus on us also to teach people how to communicate about cancer, you know, to just gently guide them through that process. And also to just locate people in our world that we can have those conversations with, because we can't have them with everyone. Not everyone's going to be able to deal with a conversation about death and dying. They're not going to be able to deal with it. So we've got to be really careful who we open up to. So for me, it's all about creating back that connect. Because we can say it's the Cancer Council or the Leukemia Foundation or the Breast Cancer Foundation, or we can say it's their job to provide support for us. But really, the support that we need will come from the people that we love and that love us. And so what I'm about is world domination. I'm trying to get around to as many people as I can to just say cancer every second word, to desensitise us a little bit to that word so that we're not so afraid anymore, so that we can do what we do here just in the general community and actually begin to bring it out into the hope. And so we can talk about the good news about cancer outcomes. So we can say cancer outcomes are much improved. Cancer treatments, you know, we're curing far more people and more people are living with a cancer diagnosis longer. It's no longer, you know, oh well, see you later. And once people get a hold of that knowledge, that's when their mindsets will be changed. So thank you so much for having me. I have a feeling my time is up. My books, I've got my books at the back of the room. There's 2 books there. Things Not to Say to Someone Who Has Cancer, which is like a guidebook for the person who knows someone who's been diagnosed with cancer. And it's actually a really, really practical guide. It actually talks them through how they will feel when they hear the news. They'll probably react in one of 3 or 4 different ways. They'll want to either bake lasagna or hide under the bed or be knocking on your door every 5 minutes. It guides them through their own responses, gives them some strategies of how they can approach you or the people around you, how to help in practical ways and how to stick around for the long haul. So that's Things Not to Say. The other one is Soul Letters, which was written from my first person experience as a person who went through a cancer journey with all the stuff that I thought they didn't tell me that I really would have liked to know. Things like when, you know, you've got 3 friends and they all think of cancer support in different ways, how do you actually handle that? You know, one brings a lasagna, one wants to cry, like, ah! How do you deal with that? And some of the things that came up for me that I didn't read in any other books. So I'm more than willing to talk to you. I realise there's no break between now and the rest of the day. So if you want to just kind of mosey up and have a chat with me about the books, they're $20 each or both for $30. And I would love to come and speak to your group. You can contact me via email. And thank you so much for having me. Thank you.
Thank you, Jo. We're delighted that you could come and give us the benefit of your experiences because we've all been there.
We have.
And thank you.
No, my pleasure.
I hope you
thank you so
enjoy
much.
this as a mark of our appreciation for the whole day.
Thank you so much. Really appreciate it. Thank you.